Good afternoon, my name is Nigel Tunstal. I'm a consultant psychiatrist at the clinic at 78 in Westbourne, Bournemouth. Brains are incredible machines, but they're not perfectly engineered and sometimes can go wrong. Mental disorder is associated with greater social and economic costs than heart disease and cancer. In ADHD, there isn't enough dopamine being released in the prefrontal cortex, and this leads to dysregulated reward-seeking behavior, which can manifest, for example, as excessive spending, dysregulated eating behavior, and substance and alcohol use. Inability to focus and sustain attention and distractibility can lead to academic and occupational underperformance and feelings of failure or problems with self-image. In most cases, this is achieved to a very satisfactory level, something like 70 to 80% reduction in symptoms, but it's absolutely not a one-stop process, and on average takes around 3 months to get right. Considerations to bear in mind are that some level of at least minor side effects are virtually universal, and it's always a question of balancing benefits against side effects. And during the initial phase of treatment, the most important thing is to make sure you can tolerate the drug, and in all likelihood several dosage increases at intervals of several weeks will be necessary before treatment is optimized. Done correctly, treatment is usually well tolerated, and once treatment is optimized, it's possible to take a long-term open-ended view of treatment, and then the only thing you have to worry about is whether to take treatment or not. If you take treatment, your symptoms will continue to be well controlled. If you don't take treatment, your symptoms will come back. A relatively small proportion of individuals will not obtain the same level of benefit, and in some cases there will be more significant tolerability problems, and a relatively very small proportion of individuals will experience significant and sustained increases in blood pressure, which is something you have to take seriously. Not everything is for everybody. Not everybody can tolerate these drugs, and where appropriate, sometimes it's necessary to make adjustments to the treatment plan or abandon treatment or treat other conditions at the same time. Generally, it's always a good idea to optimize cardiovascular fitness by doing regular aerobic exercise. Generally, it's always a good idea to optimize cardiovascular fitness by doing regular aerobic exercise. Many people try strategies for managing organizational and attentional problems, such as using diaries and alerts, and some people get some significant level of benefit, but often they have less impact than you would hope, and they won't reverse the underlying problem with brain physiology. Drug treatment, on the other hand, has far greater measurable impact on symptoms and adjustment that is verified on studies of tens of thousands of people. Aside from the main group of drugs, we tend to use first line, which are called stimulants because they tend to wake you up. So these drugs that you can't take too late in the day, otherwise you won't be able to sleep. Aside from that group of drugs, there are a number of other non-stimulant drugs that can be useful approaches either on their own or as an adjunct to treatment with stimulant medication. These other agents include atomoxetine and guanfacine, which actually lowers blood pressure and can be, for some individuals, particularly helpful in reducing emotional disturbance associated with ADHD. In particular, something called rejection-sensitive dysphoria, which is kind of a particularly intense reaction to criticism and rejection. Guanfacine tends to be used as an adjunct to treatment with stimulant medication because it's less effective in controlling the core attentional problems of ADHD. The crucial first step is accurate diagnosis, which is made according to the DSM classification system, which is the gold standard for ADHD, and follows comprehensive assessment, including review of subjective and objective measures of symptoms and their impact. In some cases, diagnosis of ADHD will not be made because the symptom profile will be explained better by another diagnosis or some other problem. Diagnosis is important because it's the best guide we've got to what treatment or other intervention will help. I'm as expert as any clinician working in this area and produce detailed reports that run several pages detailing the individual history and presentation and confirm a diagnosis according to DSM-5 and say something about the nature of the diagnosis and therapeutic options available, including details of pharmacological approaches, medication approaches, so that individuals can make fully informed decisions about what they want to do. In circumstances where diagnosis is confirmed, there is a good chance that over a period of around 3 months, we will be able to achieve significant reduction in symptoms of the order of 70 to 80%, as long as there are no serious tolerability issues.